Okay, let us have another discussion today about the anti-infective and drugs. So, anti-infective agent is agent which destroy microorganisms. As you know that there are so many microorganisms on our body, and these microorganisms can cause various type of diseases. So these microorganisms, we have to be able to understand them and how to we are going to the microbe antimicrobes we should use with them because they are pathogenic, they cause diseases in our body. So that is our today's topic. And number one, we'll talk about bacterial morphology. Some bacteria are classified depending on the shape and the current arrangement, like cocci are spherical and the shape are usually give pairs like they have diplo, and the chin we have strepto, and the clusters like staphylo. So bacilli are round like shaped and spiral are round and round like in shape. So there is what we call gram-positive bacteria, and these bacteria are based with the ability of the microbial bacterial membrane to stain either red or blue in a specific type of stain. So bacteria that takes up the red stain are classified as gram-positive, and bacteria that take up the blue stain are classified as gram-negative. So gram-negative bacteria have an additional outer layer of polysaccharide membrane endotoxins. That is toxic and that can produce endotoxic shock, toxic shock. So, antimicrobial chemotherapy is identified as the use of drugs to curb and inhibit growth of infectious bacteria. Bactericidal drugs kills the bacteria, whereas the bacteriostatics inhibit growth and the multiplication of these bacteria, and the body defense and immune mechanism required to rid the bacteria of the body. So, the antibacterial spectrum refers to the range of bacteria that are killed and inhibited by microbial drugs. A narrow spectrum are effective against a limited number of different bacterial species, and the broad spectrum are effective against a wide range of bacterial species. So bacterial resistance is that the bacteria have the ability to produce proteins that help them resist antimicrobial drugs actions. So some bacteria produce beta-lactamase enzyme that inactivate penicillin and cephalosporins, like the Staphylococcus is one of the most common bacteria with these type of problems. So some bacteria produce a protein that prevents drug from penetrating the bacterial membrane and proteins that remove the drugs once they are passed through the bacterial membranes. When bacterial resistance occur, other drugs must be used to treat the infection. So an example is penicillins. Penicillins are bactericidal drugs that inhibit cell wall synthesis. There's first generation that are narrow spectrum indicated mostly for gram-positive infections. There is what we call second generation that have a wider spectrum that includes gram-positive and gram-negative, and there is third and fourth generations that have a broader spectrum and are effective to most gram-negative types of bacteria. Then we have cephalosporins. Cephalosporins are the drugs that inhibit cell wall synthesis, and the first generation are effective against the most common gram-positive and gram-negative bacteria. There is second, third, and fourth generation of cephalosporins and are increasing against gram-positive negative bacteria. So the higher the generation, the side effect and the effective the drug. So cephalosporins are the drug of choice for infections caused by Klebsiella and pneumonia, and the Klebsiella and the cephalosporins are more resistant to inactivating beta-lactamase enzymes than penicillins. So, what are the adverse effects common to penicillins and the cephalosporins? They can cause diarrhea, that is GST disturbance, and they can cause sometimes hypersensitivity or allergic reactions that include delayed skin reaction or immediate anaphylactic shock. And high doses may cause bleeding problems. High doses may cause central nervous disturbances and a possible seizure. So aminoglycosides is another class of drugs. These are broad spectrum antibiotics. They are bactericidal drugs that inhibit bacterial protein synthesis. They are either administered either IV or IM for synthesis effect, and usually drugs of choice for serious gram-negative infections. They can cause nephrotoxicity, and sometimes they can cause ototoxicity in most cases. So we have other drugs like tetracyclines. Tetracyclines are called bacteriostatic that are inhibit bacterial growth uh, and the protein synthesis. They are administered through orally, but not with dairy or antacid product because they have a cross reaction. So doxycycline is the most widely used tetracycline and usually takes once per day. Adverse effects include GIT disturbance, rashes, and photosensitivity. Tetracyclines are contraindicated during pregnancy, during nursing mothers, and also in children less than 8 years. Sulfonylureamines is a bacteriostatic drug that inhibits bacterial folic acid synthesis. So sulfonylureamines are mainly indicated for treatment of urinary tract infections, and trimethoprim and sulfamethoxazole as approved antibacterial spectrum and medication and many indications. This is a septrin. So adverse effects include rashes, allergen gland disorders, and damage, tibial damage. So if you give a patient a lot of septrin, they can end up having disease. Then we have macrolides, antibiotics. Macrolides are bacteriostatic drugs that inhibit bacterial protein synthesis effective in the oral administration. So erythrocyte is often used in penicillin allergic patients for minor ear and throat infection, and erythromycin and have a broad antibacterial infection and in clinical uses. Adverse effects include heartburn, rashes, and GIT disturbances. So we have another type of drug called fluoroquinolones. Bacterial drugs, single drugs that inhibit enzyme essential for functioning for bacterial DNA. They are administered orally, indicated for a wide variety of urinary soft tissue, bone, and respiratory infections. Adverse effects include GIT disturbances, rashes, photosensitivity, and joint pain, contraindicated in pregnancy and children. So miscellaneous antimicrobials is called is reserved for serious infections such as typhoid fever and meningitis. Chlamydia, clindamycin is indicated for gram-positive and anaerobic infections, and vancomycin is indicated for resistant gram-positive, and vancomycin is commonly used in bones. Then you have quinosprin and daphrosine and linozolin indicated for gram-positive infections resistant to vancomycin. So drugs used for treatment of tuberculosis is requires around 6 months of treatment, where the first line include that is isoniazid, rifampicin, and pyrazinamide, and ethambutol. Then after that, the patient continues with ethambutol and pyrazinamide. And isoniazid and rifampicin and therapy is continued for 6 to 12 months, and this is that is the major problems. Then we have antiviral and antifungal. Antifungal are prevent treatment for severe fungal infection. Antiviral drugs is treatment of viral infection. So there are various types of antifungal and drug. For example, you have various fungal infection like aspergillosis, histoplasmosis, candidiasis, and cryptococcus. Cryptococcus causes cryptococcal meningitis. Histoplasmosis and aspergillosis is very common in the lungs and associated also with bats. The site is the brain lung, and the fungal is the treatment is potassium B, ketoconazole, miconazole, and nystatin. Then we have the dermatophilic, which is affect the hair, skin, and the nails, and the treatment is alcoholic and toner fluid. Then you have Candida albicans in the skin, mucous membrane, and the vagina. And the treatment you can give nystatin, miconazole, and the ketoconazole and drug of choice. So a mechanism actions of antifungal is that antifungal is capable of killing the fungal. It binds to the fungal membrane and increases permeability and increasing to nutrient leaking out, and also that means it interferes with the can lead to destruction of cell organelle. So the drugs of choice is like amphotericin, ketoconazole, miconazole, and nystatin. And the fungostatin limits the growth of active fungal, but it does not elicit microorganisms. The drug binds the keratin in the skin and the air, so fungal cannot enter the tissue and undergo further growth. Like lisosorobin is what is called fungostatin. Contraindications of antifungal is patient with history of hypersensitivity. So glycosorbin is contraindicated in patients with porphyria and hepatic failure and is not used during pregnancy. Then lastly, we have antiviral drugs, and that is viral drugs like viral conditions like smallpox, chickenpox, and measles and polio. These type of conditions are not well treated because virus always inhibit the human cell, and so you have to destroy the cell for you to destroy the virus. So the most key about viral infection is that you concentrate on what? On vaccinations. So no immunity transfer with infection in viral infections like influenza, herpes simplex, human diseases like HIV virus goes undetected within there for many years. It attacks the lymphocytes, it progresses into immunosuppression, opportunistic infection develop, clinical signs and symptoms characterized. Uh, propagation of viruses is that the total dependent on the metabolism system by human host attack to cell membrane to join DNA and RNA in the cell. So we have antiviral drugs like influenza, the best one you can use the matadine and the amantadine. HIV, you can use dinanosine, ranitidine, and squinavir, and novidine, cytomegalovirus, you can give CWR, and fosandine, and gangrovazine, and herpes, you can use acyclovir. Then herpes simplex, you can use vinorapline, and triptophan, and exudamine. So antiviral mechanism of action is that the inhibition of cell penetration and amantadine stops Asian strain 2 when the resistant prophylactic for 2 hours are end. So transcription, it works in prevention of cell penetration. Those transcription of viral proteins. These are the drug which inhibit transcription of viral proteins like adenosine, lamivudine, stabudine, azacitidine, azitabudine inhibits the vast transcription, so HIV RNA cannot be replicated. So there is other drugs which inhibit viral synthesis like acyclovir, imidazolline, and darabavir, and incorporate DNA of HIV and impairs protein synthesis. Then we have protease inhibitors, indonavir, ritonavir, sabinavir, and which makes sense of HIV infection. So special consideration is that HIV protease inhibitors inhibit liver metabolism center, that is the enzyme 450 coenzymes. So also that other medication may accumulate in the blood because of blockage and delayed metabolism. So renal impairment will cause a viral antiviral drugs to accumulate in the blood and does not, and antiviral will be required. So amantadine and imatinib doses must be reduced in the elderly where renal clearance has decreased. So, anti-HIV drugs adverse effects like nausea, gastritis, vomiting, diarrhea, confusion, dizziness, insomnia, allergic reactions, and MRS and hypertension, nephrotoxicity, and inhibition of hepatic metabolism and anemias. So a characteristic of antimalaria is that there is what drug before antimalaria. They are highly bound to plasma protein that makes they circulate in the body, metabolized in the liver, and they produce anti-inflammatory response in conditions like rheumatoid arthritis, lupus, polymyositis, and relaxes skeletal muscles, stimulate contraction of internal muscles, depression of cardiac that conduction, the can interfere with ECG appear. So the adverse effect of antibiotics is that they can cause nausea, diarrhea, headache, blood vision, fatigue, and rashes. And sometimes drugs like quinine can cause something called syncosionism, which results to sensitive individual experience like ringing in the ears that is called tinnitus, headache from CNS uh, uh, stimulation. Then we have other diseases which we call them protozoa, dysentery like Iragia rambli and Entamoeba histolytic require treatment because of various problems. Like this type of drug diseases, they can cause symptoms like acute infections, irritation of the intestinal tissues, inflammation and pain, spasm of the anal sphincter, diarrhea, fatigue, and muscle and weaknesses, loss of body and electrolytes. So chronic entamoeba dysentery can result to entamoeba histolytica, which can burrow on the walls of the liver, creating inflammation and also abscess, which is commonly called hepatic liver abscess. So anti-dysentery drugs like paramycin, tetracyclines, metronidazole, and chloroquine, endocrine are the most common types of drugs. So then we have parasitic worms, drugs like pinworm, like roundworms and tapeworms. These are the other types of Okay. And symptoms of this type of worms is they can cause diarrhea, nausea, vomiting, itchiness of the hand region, and also hookworm, tapeworms, perforate intestines, and rest to a chronic iron deficiency, anemia due to bleeding. Then we have antiemetic drugs like drugs which works on pinworm, landworms like mebendazole, pantera pomoate, and the albendazole. Then you have tapeworms which you can give praziquantel. Then remaining within the antiemetic drugs remains within the intestine, decreases worm motility by paralyzing the parasite muscle. Peristalsis and laxatives move the worm's eggs out of the intestines. So the adverse effect of these antiemetic drugs is that they can cause nausea, fever, headache, cramps, diarrhea, tinnitus, and hypotension. Then we have what we call antiseptic and disinfectants, prevent, control infection of breathing. Antiseptic services and breathing disinfectant services include contact top floor equipment, instruments, skin, mucous membrane. Forms of antiseptic and disinfectant chemical solutions commonly used in our setup is like Arco, an example is ethanol and isoplano, and inhalants like formaldehyde, halogenated carbon like iodine, and ionophores like povidone, phenols like hexachlorophene and triclosan, oxidizers like hydrogen peroxide, and heavy metals like silver nitrate and mercury. Quaternary ammonium mesocodium chloride is all these are forms of antiseptic and disinfectants used in our place. So methods or use of and these ones are used topically for washing swabs, sponge, and mouthwash sometimes are used in this one. So there are various terminologies which are used in in this sector of antimicrobial organisms, like cyno is to kill, statics is to inhibit growth, sterilization is to complete eradicate microorganisms, spectrum of activity is the spectrum or the species on which they work. Then subcommon infections are infections which you can acquire in an hospital setup. Irrigation is to wash with the fluid antiseptic. Active vehicle is the solution used to dissolve the antiseptic as a separate definitive ability to destroy microorganism. Topical is applying on the surface or swallowing. A systemic is releasing the blood as circulation. So main uses is that they reduce the need of antibiotics by eliminating potential pathogenic infections, organic materials, or non-living services. They reduce the growth of contamination of wounds like burns, skins, elimination of microorganisms from entering puncture encountered in procedures such as spinal region, anesthesia, brand, and all these type of things. So the adverse effect is that topical application can cause dry skin, rashes, hypersensitivity, can cause eczema, dermatitis, and also can cause hypothyroidism, and also can cause neurotoxins like back pain. So from internal absorption can cause anemia, anorexia, vomiting, internal cramping, convulsions, and death. And that is all the end about this topic. Thank you.